Well, good afternoon, everyone, and welcome to our second webinar from the Western New South Wales Primary Health Network and the Digital Health team on the active script list. But this one is specifically for our pharmacy friends right across the region. So welcome, and let's get into some housekeeping to get us underway. As always, you can type any question into our chat box and we'll address them at the end for discussion. Everyone is on mute, and like always, we always record our sessions, which will be made available on demand if you registered for this webinar but couldn't join us today. And of course, it'll be followed up to via our YouTube channel. But first of all, let me start by acknowledging for today's meeting the traditional owners and custodians of the lands in which we all are meeting today. And I am all presenters today are coming to you today from Wiradjuri land, and we pay our respects to all First Nations people and acknowledge elders past, present and emerging, and recognise their continuing connection to land, water, culture and communities. So I do extend respect and warmly welcome all Aboriginal and Torres Strait Islander Australians who are present here today. And thank you so much for taking the time to join us. So our presenters. So my name is Brenton Jones. I'm the Manager of Digital Health for the Western New South Wales Primary Health Network. And of course, I'm joined by my colleague, Lisa Bowes from the PHN. And the exciting thing today is we've brought in a guest pharmacist, Spencer McTavish, who is from Bathurst in our region and works for Capital Chemists. And we will introduce him more formally towards the end of the slides to engage in a conversation regarding real-world insights and learnings from the coalface. But what are the learning outcomes? And I think one of the things, before I get into these 4 bullet points, at the end of the day, if you're sitting watching this either now or a future recording, you know, the purpose of this webinar is really going to try and talk a lot about benefiting those pharmacists working in retail, script in, script out, dispensing of medications. But we're going to try and, where possible, you know, I believe this presentation's for those pharmacists, especially locums. If you're a locum pharmacist and you're doing a lot of work in the rural and remotes of our region, where it's just you're the only pharmacy in town, there's very little support potentially from the owners of that particular pharmacist. What are some of the practical things you can use, especially to adopt the benefits of a fully electronic prescription and active script list workflow? So we're going to focus on explaining what is active script list, or in pharmacy world, it's often referred to as My Script List or MySL, and how it can be accessed. We'll discuss the benefits for individuals, for yourselves and the healthcare system in general. We'll also outline ways in which prescriptions can be accessed from dispensing software using ASL. And then quite specifically, we'll look at that MySL registration and consent workflow in the context of your dispensing software. We tried to do as much as we possibly could with screen grabs across all the different dispensing software, but we don't go into a detailed walkthrough of each dispensing software for obvious reasons, but highly encourage you for further learning, continuous improvement. If you haven't done it just yet after today's webinar, go into your software providers, follow their videos and walkthroughs on the specific MySL workflow. All right, let's just kick off. I think contextually it makes sense. We're going to look at electronic prescriptions as a general overview. I would assume most of you are very much across this, but again, it helps provide good context. So what are they? Secure and convenient digital alternative to paper. So we know that we have electronic transfer of prescription, which is your barcodes on paper scripts, but again, an electronic script is unique in its legislation as a digital alternative. And you can choose to receive, or, you know, patients can choose to receive via your healthcare provider and request that to be sent to your active script list as well. And most pharmacies are set up to dispense medicines using electronic prescriptions today. But what are the benefits? provides that alternative choice. Australia's legislation with the Privacy Act is very, very clear. Nothing's changed, really. And that is all Australians should have freedom of choice in terms of how they access, how their data is managed. And there's no difference with prescription management. But ultimately, in the clinical context, reducing transcription errors, the good old-fashioned handwriting. I'm sure pharmacists are nodding around those horrible days. And I do know that some specialists even today still handwrite, and in certain hospitals still handwrite. So we want to try and eliminate that and improve the operational flow of information with e-scripts. It's convenient access to medications in a centralized location, and we'll talk about that mechanism regarding the PDS and the cloud. But supplements the delivery of telehealth too. We've known this since COVID. It's really been very, very supportive of remote medicine, and protects community members from exposure to infectious diseases, maintains privacy, reduces the risk of lost barcoded paper prescriptions, and reduces administrative burden for healthcare professionals and organisations in general, especially for that coordination of care. So what is a token? Again, most of you will be aware of this. You remember the days of the rollout of e-scripts in COVID, where that 3D scanner, pharmacies rushed to go and buy the 3D scanners that could read a QR code, and that was the new world then. And this unlocks the script. So that scanning tokens also contain a CID, which is located at the bottom. All right, that's a unique URL link. And the mobile device will display the token in a manner suitable for scanning. But of course, you may have experienced some patients may print out, the GP may have printed out that QR token for the patient as well if they don't have a smartphone. And a unique token will be generated for each item prescribed and each repeat issues. All right, we'll talk about the repeat, and that's where the pharmacy software comes in. But this is the flow diagram of what I meant by that information exchange. And so we now have a single provider, right? The Department of Health a couple of years ago now decided to consolidate and have a single provider for all Australians of our national network, being awarded to ERX. We know that as pharmacists, you would need to register both the organisation as well as individual pharmacists using your HPII to subscribe to the ERX to be able to draw down. That's you on the far right as the community pharmacy, and the prescriber, the GP, the specialist, they had their own registration to the National Prescription Delivery Service. But in the middle, we have our patients and that choice. And in particular, there's the token system. And as we'll get to in a moment, the active script list or my script list, when that's fully operational, when patients have registered, they consented to the pharmacy, we can completely remove the need for a token even to be presented, provided the prescriber has sent an e-script from the get-go. So let's get into it. As you, again, these will be very familiar to you on a smartphone device. We have the token system. We have pharmacies must provide individual with new repeat. So again, this is if say one of three, the dispensing software will take over to issue the repeat token. And from an individual's perspective, these are the other forms. They can opt to receive it via email. This is what it looks like if it's received in the inbox. And of course, they can also elect to display it from an email link, or they can even get their GP to print out that QR code, as I mentioned before. Tokens, they can expire, show as dispensed or cancelled, and these are all the messages that are available. What can they be used for? Well, pretty much all the above. The PBS medicines, authority prescriptions, Regulation 49, private, even non-MBS prescriptions, and of course, Schedule S8s. Now, little note there, must comply with any state, additional state and territory related. There's always that layer. It's a wonderful thing about Australia. We've always got those additional layers. Federal versus state, so it's important to be across those as well, which I'm sure most of you are. I think these are the 5 management options for Australians when it comes to medicine safety or medicine management. So we've got our token. If we very rarely, we don't have model meds, we're very rarely accessing medicines, then accessing the odd token, especially if you're not on regular repeat medicine, token as an option. You can nominate carer representatives, and we'll go into a lot more detail on that when setting up registration of MySL in the pharmacy. Use mobile apps. We'll talk about the activation codes and how that kicks off the management of scripts within the app itself. Then there's the register of the active script list or my script list, and then there's the viewing and managing and using the authorized apps. But at every point of these options, the patient's in control. That choice is critical. So let's get into the ASL. As in the name describes, it's in the word active. It's a list of an individual's active prescription tokens available to be dispensed, or the electronic dispensing. So again, you will see electronic transfer paper listed, as well as the e-scripts themselves. And pharmacies can access an electronic prescription for an individual from an ASL following consent and proof of identity, which we'll go into. Its registration is completed by participating pharmacists only, not prescribers. So unfortunately right now, with conformance profiling from the Australian Digital Health Agency at the moment, today, in August 2026, still pharmacies and the dispensing software is the only software available to Australians that can complete registration and consent. Dispensing software and some prescribing software have the functionality to view individuals, and that's where our webinar from last month to GPs, where we highlighted the fact that within GP clinical information software, they can now request consent to view only an individual's ASL. So registering. This is where pharmacists are essential to getting community engagement and getting patients using and adopting. So registration for an ASL prompted by individual or pharmacy staff. Verify the individual's identity. So the software is going to prompt for proof of identity. Access ASL from your or MySL. Find the individual on your system and complete the registration form. A consent and access request is sent to the individual. So this is something that you'll prompt for them if they do have a mobile phone on their person in pharmacy. This can all be tackled at the scripting desk, for example. But we'll talk through some examples of where if a particular customer doesn't have a mobile device or an email access right then and there, or they've opted out and don't have access to digital technologies, there are workarounds. They acknowledge and respond to both messages. So the reason why we say both messages is step one is you're formally registering. And what we mean by another way to express this is you're effectively switching it on, okay, in the PDF, in the cloud. So by default, it's not on. So it's kind of like an initial opt-in to switch it on. And then the second step is they have to consent. And we'll talk about the consent process in a bit. The registration, of course, is just done once, never again. But the consent process can happen multiple times at multiple pharmacy visits. So this is what it looks like. It comes through in a text message. So either yes, grant ongoing, yes, for 1 day only. And this is good for situations where if a patient's trying to access their medications in a different state or a different pharmacy that's not their regular pharmacy in their place, the place where they live, they can say, I just want you to have access for today's dispensing. Or of course, no, but no is quite obvious. If it's no, it won't proceed. It won't turn on. Let's move on. This should be familiar, the very, very simple spreadsheet view for most dispensing softwares. But of course, this is what we mean by the electronic prescription process. You've either got the token as an e-script or there's the paper version with, again, the electronic transfer barcode will all appear within an active script list as follows. And you've got the date it was created, the prescription, the repeat, right? And then, of course, the type. And this is what you're looking for at the end of the day at the point of dispensing. If it says token, then the patient does not need to present a token, okay? But if it says paper, naturally, you're going to need to have the paper on record. That's the legal form. So how do individuals, how do Australians use MySL? So an individual attends their preferred pharmacy, and request to be registered. That's the first step in community. The individual attends the doctor and requires a prescription. That's one way. If the individual chooses, an electronic prescription is provided and is automatically added to the ASL. So it's a by default. The individual then presents to their preferred pharmacy, validates their identity, and medicine is dispensed from the ASL. The repeats, if any available, will be added to the ASL by the pharmacy. That's at that pointy end, right, of completing the process and managing it from then on in. But let's just quickly talk about care and representatives. So, and some of you, if you've been through this before and you're dispensing software where you're registering a patient, it will pop up the option to prompt you to ask the patient, do you have anyone that can act on your behalf? So individuals may nominate on their behalf and you have a carer. So this is a person or organisation who has the same ASL rights and access as the individual. So for example, a parent collecting medicine for their child, or a representative, a person whom the individual has authorised to collect, to receive a dispense on behalf of that individual. And this has to be recorded in your dispensing system for proof. The individual is responsible for getting consent from the care representative and communicating this to the healthcare provider. So look, let's, and Spencer may have some further insights on this later on, but 3 broad categories here of individuals who would benefit from using ASL. This has come out now since my script list has been active for quite a few years now. But generally scripts on file individuals. So pharmacies can provide a scripts on file service electronically using the ASL. That workflow is seamless. The individual takes multiple regular medicines. This is probably the big one. It removes the need for individual to manage multiple tokens. I can't tell you how many times I've been, in pharmacy or working with GPs where I've seen someone struggling to find that repeat token that was issued 30 days ago, and they're getting that anxiety sets in, right? You can remove that by encouraging those kind of people who are constantly in that situation, remove the anxiety, remove the stress, and let the ASL run it. And individuals that have lost a repeat token, right, or lost their paper scripts, or forgot to bring it. This is the most human of all behaviours, right? Individuals are not required to present a token when registered. This is the peace of mind thing we keep talking about. Is you as pharmacist managing day in, day out the traffic flow in a busy retail environment. You're going to be more knowledgeable about your customers and their behaviours, and so you're better able to identify and encourage at that particular point the recommendation to register. So look, like everything regarding medicine management, we have policy requirements and legislative frameworks. So there should be security and access policy, privacy policy, data usage policy for your organisation in order to enable electronic prescriptions and operating. And that means reading and understanding the active script list privacy framework. That's that management of data, right? That encapsulates to make sure that that cloud infrastructure is functioning appropriately. And we know that those security measures, for example, are locked in those unique identifiers, the health service identifiers. We talk about HPII as professional pharmacists. You have your HPIO, that's your My Health Record registration as part of all this. And they're the layers of the security onion that authorises you to have access as professionals in your field. Not going to labour the point, plenty of legislation. This is Australia after all, plenty of red tape, lots of fun reading, but again, this is the compliance bit, this is the governance, and it's certainly worthwhile if you're part of a larger pharmacy group. I'm sure that this should be looked at from the top down before rolling out any adoption and use. Right, let's get into the practical kind of utilisation of MySL, activating codes, registering workflows, that sort of thing. So now some of you will know, and there's some usual suspects out there. but for example, we've got Scripty, we've got MedAdvisor, you've got Terry Chemmart's version, I think it's My TWC or something. But of course, in the context of this presentation, I'm going to talk about the federal government's 1-800 Medicare app. So that's your My Health Record app. It now has the ability to manage your scripts in the My Script list as well. Thankfully, finally, which is a great benefit. So when a patient elects to manage, and you could recommend the management of scripts with an app, an activation code needs to be generated by the dispensing software only. Again, GPs can't do this. This is a job for pharmacists. All right. So they will need this to link it. All right. So I'm not going to go too much into detail here, just that the 1-800 Medicare app, highly encouraged because it's a full record, especially My Health Record, available in the palm of every Australian's hands, but a very secure and convenient because it's linked to MyGov, right, or digital ID. So that security is locked in and gives individuals access to e-prescriptions and the active script lists, which pharmacists will know as MySL, and has other great features like Find and Book a Health Service, amongst others, right? So highly recommended. But of course, MedAdvisor is also a great one and been very popular throughout the years as well. So activation code requested by the individual at their discretion, and they'll ask for this activate. They'll be prompted within the app from a pharmacy staff. Okay, so again, we'll talk about the training and requirements for all pharmacy staff at the point of this sort of service, but first ensure they are already registered. So you're looking for that MySL button that's green ultimately. All right, if not, register them per the normal process we talked about. Then you need to generate the ASL activation code and provide the code to the individual. Now, please note, it's different for all kinds of pharmacy medication apps in terms of the user interface, which I'm not going to go into detail here because it's specific. But how do you generate? So where the code is displayed will vary depending on the software you use, and we'll show a couple of examples of screen grabs. To generate the activation code, there will be a button or tab to select within the ASL screen. So that's why you've got to be registered and consented first. It may display as Get Activation Code, MySL Activation Code, or just activation code or something of a similar wording. And here's a very, very quick screen grab of 3 popular softwares, Fred, Minfos, and ZDispense. And you see each one's different, but either way, you're looking for that retrieve code or activation. Code is the common denominator here. So in terms of the workflow for the patient themselves, again, just for your information, but a good reference if you're assisting a particular patient because they're struggling to use the particular app, then this is something that you can support them with. So within the 1-800 Medicare app, they're going to go to medicine and electronic prescriptions. They're then going to click on electronic prescriptions, and then they should see the active script list, how to register it. So tap that, and then tap enter activation code. So that's hence the prompt, right? There's also some education here for the patient. It reminds them of the 100 points of ID if they haven't registered and all that kind of stuff. And then we have enter the activation code here, and then it effectively kicks into gear. And then within moments, the patient themselves can see the scripts that are currently active for dispensing. PBS authority prescriptions. I won't go into too much detail on this, just that conformant software will allow prescribing a medicine as a traditional paper script as well as electronically. But PBS authority prescriptions can be prescribed electronically, where the approval code can be obtained at time of prescribing. So for example, HPOS, PBS phone authorities, all that kind of stuff. If there are any GPs listening to this webinar after this date, of course, best practice, Premier just announced some wonderful initiative, I think through LIBOR using AI, where you no longer need to go to HPOS or phone. That it will all be done in clinical information system, which is exciting news for the prescriber end. But when you are prescribing an electronic prescription for a medicine, which requires an authority, it's important that you still follow the normal processes. And then here we have review prescription and choose a method of delivery. So good opportunity to remind prescribers. Now, look, I'm mentioning this because, we're very familiar that pharmacists have a very strong relationship with GPs in community, and you have conversations regularly. I've even recorded a podcast with the team in Forbes where that relationship is critical. In fact, the adoption of MyHealth of the active script list, MyScript list in that community wouldn't happen without the GP working with the pharmacists as a team to encourage patients collectively to get on board. So it's a good opportunity to remind prescribers to always confirm the phone number and email address. Right, it's one of those things we always do with GPs to make sure that information is captured at the point of care upon registration and booking in a consultation, for example. Is regularly check that information, as it just helps that process run smoothly. So just quickly on withholding prescriptions for ASL. So again, patient choice, right? There might be a particular prescription or medication where the patient chooses for a particular reason not to have that available on the active script list. It could just be a one-off bit of medication for some treatment. So individuals agree to their prescriptions being available in their ASL during registration. If an individual has an ASL, prescriptions will be uploaded by default. So once that, so the prescriber system in particular, it's just by default it goes, unless opted out. So it's an opt-out mechanism. It is the individual's responsibility to inform their prescriber or dispenser if they wish to withhold a prescription from their ASL. So I've focused specifically on pharmacy software, dispensing software. This is an example of Fred. So withholding consent to add. In this instance, you need to select exclude from active script list, or something that might be equivalent wording. You can see it here. So dispensing e-prescriptions. Again, assume a lot of you are across this now quite well, but this is an example from Fred. Some key fields are highlighted in red. These may appear differently, again, depending on what software you use. Option to withhold script from ASL. Prescriber notes and dispenser annotations will be visible to the pharmacist. And original prescription details and recent repeat dispensed will be visible to the pharmacist as well. So you can see here, don't assume that the details on file are correct. Always triple check, measure 3 times, dispense once. But you do have that confirmation regarding preference. Okay, so email, none, print, SMS. Resending a repeat token. This would be part of regular workflow. Again, there's some examples of different software. Check the SMS or email is correct before resending. This is the checks and balances. And it's always worthwhile, of course, checking too before a particular person leaves your pharmacy is, have you got it? Ask them, have you got that on your person? Can you see it? Examples on screen of what that might look like. All right, so you can see this is a button here, reissue. You got reissue pop-up to follow the prompts. And again, here's this view, dispensing medicines from your ASL. So when viewing the ASL, it is clear to distinguish between computer-generated paper, as I mentioned before, with the barcode appearing, as well as tokens. So computer-generated paper scripts with no ERX barcode and handwritten scripts will never appear in the active script list. Hence why the benefit, right, that communication with regular GPs to, if you've got some customers / patients who you would like to manage through a MySL, if you're not seeing their regular GP e-prescribing by default, then encourage them, work with them, talk to them, get their patients, empower their patients to have that conversation with their GPs, take charge and say, listen, to make utilization of the ASL experience seamless, anxiety-free, is make sure that the prescriber is e-prescribing by default to begin with. This allows for a lot more easy access. So dispensing paper and electronic prescriptions for individuals with ASL. So most of you would understand this. So check the barcode of paper prescriptions provided for dispensing. Barcode of paper, dispense the paper, retain hard copy on record as you would. ASL will be updated, repeats will be visited, and token cannot be issued. Why? Because it didn't originate as an e-script, so it's paper. That's why you keep it on record. E-prescribing, however, is that fully electronic workflow. That's the only thing you need to remember. So, pharmacy staff responsibilities. Scripting checklist. So really you're at the coalface, as I said. That's a valuable education point for all Australians, is individuals assisting with locating their tokens. So there's that SMS, search for the sender, e-script SMS. If you've got someone who's, oh my God, where is it? Okay, especially if it's a repeat, it's like go back. If it's every 30 day, go back 30 days and again, search e-script SMS. Emails, if they're looking on emails on their mobile phone, that's who it should be from. So again, search from. Still having an issue? That's your prompt. Can I recommend, have you heard about the active script list or my script list? Let's register you. It should take 5 minutes and it'll save you a headache moving on. So complete the individual detail check and confirm contact details on receipt of token. Script out checklist. So that's the in, out. Confirm the individual has received the repeat token, as I said. Let's see some evidence. Educate them on how to use those repeat. And again, that's the recommendation of use an app to contain and manage all these in one simple location. Rather than going through Messenger, right? You're going through the app and it's just one click, it's there. Educate about the use of those and instruct individuals to contact the pharmacy if they need the repeat token to be resent. A couple of clicks of the button, you can do that. So just some tips for pharmacists, generally speaking. Avoid automatically overriding individual details when scanning. Reconfirm details with the individuals themselves. Check electronic prescriptions from the full electronic prescription on screen, including annotations, and do not check from the token, right? Because remember, the token, the best analogy, the token is just a key, right? It doesn't contain the meat on the bones that you need. It just unlocks it. So active ingredient prescribing. Don't assume that the software will automatically choose the correct brand. I'm preaching to the converted. I'm pretty sure this will be part of your frustrations day in, day out. Software error, report it to your vendor. And clinically assess the appropriateness of the medication for the individual as per practice standards. I'm going to walk through a very, very quick case study just to highlight bringing this all together. And then I'll stop sharing my screen and we'll invite Spencer to the microphone to share some other observations. So we're going to meet Tracy. So she takes multiple medicines. She likes the convenience of not having to manage paper prescriptions anymore, but does find it challenging having to keep track of the multiple SMS messages and tokens on her phone. Tracy has several electronic prescription tokens, and one barcoded paper prescription for oxybutynin. So again, she's got that dual juggle going on, which is not too uncommon. So registering for ASL at the pharmacy. So at the pharmacy, they explain what an active script list or my script is and suggest to Tracy that she registers for one. Tracy agrees this would be a good option for her as she would not have to worry about finding the messages with a link to tokens every time she visits. Tracy provides her driver's license and Medicare card to satisfy the identity check, which is entered into the dispensing software to register Tracy for her MySL. Now consent. That's the registration, now the consent. So consent and access requests are sent to Tracy using her preferred contact method, SMS or email, which she acknowledges and responds to after checking the terms and conditions. This allows her ASL to be pre-populated with all of her existing prescriptions, and the pharmacy is able to access her list and dispense requested prescriptions. So note that individuals must be made aware of and agree to a MySL before registering them. Consent must also be obtained through the individual's preferred method or contact, registering an individual for an ASL. Now, one thing I might just pause here and mention, if you have a customer, a patient that is not connected to the world digitally, they don't have a mobile phone, they don't have an email address, and they don't have carer or representative, right? So they are analog in every sense of the word. Then there is a workflow you could potentially adopt where you could request their consent and acceptance to use your dispensary inbox email, and make sure you're sharing the computer screen with or print it out, right? And then make sure the patient, the customer themselves, cites using your email inbox, and you record that in your dispensing software that the patient has cited that particular email and given consent. So visiting the doctor. The next time Tracy visits her GP, she is prescribed Zosyn for her high blood pressure. She asks for an electronic prescription, which is then automatically available in her ASL. I think it's important to recognise here, and this is where pharmacists can really help educate patients at the coalface, is most GPs, they prescribe by default paper. Okay, we can't blame them. It's been so many years now. It's been the one go-to. It's like an automatic action. Brain to arm, pull out the paper tray, in it goes, and they don't stop to pause. But this is about patient choice. We've got to empower people to start saying, hey, GP, before you, just so you know, I prefer e-prescriptions. That should allow actually the GP to check box in their record that from then on, e-prescribing by default should be the preferred. Accessing the active script list. So Tracy leaves town to visit her daughter and help look after the grandchildren over the school holidays. While she's there, she visits the local pharmacy to have her prescriptions for Zosyn and oxybutynin dispensed. Tracy hasn't visited this pharmacy before, so she is asked to provide identification documents in order for the pharmacy to have permission. So it's not registering again, it's just that consent mechanism kicking into gear again. Tracy then receives an SMS which invites her to allow the pharmacy access to her ASL. She agrees to the terms, conditions, and consents to the pharmacy accessing it for that one day only. Okay. So dispensing the medicines. When the dispenser accesses Tracy's ASL, they can see an electronic prescription for Zosyn and a barcoded paper prescription for oxybutynin. The dispenser selects Zosyn from the on-screen ASL display, and the electronic prescription is downloaded from the cloud so that they can dispense via your software, the medicine. So dispensing records. The dispenser asks Tracy to provide the paper prescription for oxybutynin and scans the barcode to dispense just like you would with normal flow. She's provided with her repeat when receiving her medicines. Tracy's ASL automatically updates to show that both prescriptions for both medications have been dispensed and shows the number of repeats remaining. Now, note, dispensers can also delete, edit the dispensing record if an error has been made, and prescription information will be updated to the individual's ASL at that particular point. Tracy wants to view her ASL. Pharmacist tells her that some mobile applications like the 1-800-Medicare app or MedAdvisor have this functionality to keep it all in one place. Tracy then downloads the app, logs in, requests the activation code from the pharmacy to link her ASL in the app. After entering the code, she can now view them all, one click of the button. Now, just quick little reference to additional sources. I'll leave this up on the screen for a little bit longer, but there's a lot of resources out there. There's the Australian Digital Health Agency's resource library. There's e-learning modules, lots of fact sheets and material. There's a YouTube channel and plenty of information on the agency website. But of course, again, like I said at the beginning of this webinar, your software provider, refer to your vendor. Your software provider should have lots of how-tos and guides too in the context of MySL, which is the common language used within pharmacy dispensing software. Plenty of also other resources, a few links here, but you can also contact, besides myself and my colleague Lisa, we are local resources for you within the Western New South Wales PHN. We are more than happy to come and visit your pharmacy, do on the ground training for technicians, for pharmacy staff, especially supporting that workflow, or even talking about policy and how you can work through change management. Because if it's not something you have actively done, but you would like to support the community to get on board, then you need to work through script in, script out process. And that's hard if you're a locum or by yourself. You've got no pharmacy staff to support you. You're flying solo. So how are ways that you can introduce this that's manageable? And of course, we would love your feedback. Lisa's going to also put a link, if you don't mind, Lisa, into the chat too. For this webinar, your feedback is always valuable, and we definitely use it to report back to the agency and to continuously improve. But I'm going to now move on. I'm going to stop sharing my screen and take a breath and welcome to the screen formally Spencer McTavish. Spencer, I'm really happy you're with us today because you get to talk to all the truth here, the good, the bad, and the ugly. But I'd love to get your initial thoughts on that case study, right? Is that familiar to you? Is that not so unique, or is it unique?
No, thanks, Brenton, for the introduction there. Sorry if I'm a bit hoarse. Yeah, I guess that's quite an accurate scenario, right? I think to me, the take home from e-scripts in general is, on one hand, you have the patient choice, which is really important, providing options to help manage your patient's, medication and overall health, multiple options, because not everyone's the same. I think that's a really big takeaway, is that it's really, really valuable to be able to provide options like that. And then you as the healthcare provider, it's your responsibility to, educate and discuss with your patients and figure out what option actually suits them best, what suits their lifestyle best, and understanding of medication and prescriptions and technology best, which will then best suit their needs. I think here at the pharmacy, we definitely, like at Capital Chemist in Bathurst, probably one of the big things we do, I guess, and pride ourselves in is, being able to solve problems for our patients. And that includes problems that they don't know they necessarily have, right? So overall, looking at, I guess, different friction points in the healthcare system, and in the medication management, I guess, journey, you'd say, and being able to maybe reduce those friction points and make everything a bit more seamless.
Yeah, I love that sentiment of we're in the business of helping to solve a problem, right? And ASL is just a tool, a really convenient tool that you can at that particular point draw upon, which is lovely. I'm just wondering if you can give us an insight too regarding, I guess, education and training of pharmacy staff regarding active use and adoption of the ASL. What's your policy there in the pharmacy, and how do you work through that?
Sure. So I know, I think every pharmacy, or not every, but most would have, be QSPP or QSPP now accredited, would have kind of these, I guess, digital health policies in place, or data management policies in place. In terms of training, it's a good point, because I guess everything in health and I'm in pharmacy, so I can give that example, moves so quickly. So a lot of it is, to me, little tweaks along the way where a system's improved, and then it's about communicating that maybe small change month on month or week on week to your staff, so that they can apply that to then every patient they help. So it's a lot of paying attention to change as it comes and making sure you communicate that effectively as a leader. And that, that might be, I guess we here are very fortunate. Like, we have 5 owners who actively work in the business every single week. So that's probably the opposite scenario to what you're explaining, which is, or maybe thinking of and catering for, which is, you have a locum pharmacist on deck, and maybe the owner is not there to help guide. But nonetheless, like, if you're a pharmacist on duty, you're the leader in the team, and you can absolutely, I guess, drive change, whether it be a small or a big one, to help everybody on the daily, I think.
Yep, that's right. And it's a team effort, right? Yeah. So you can draw on the PHN, for example, to help be that mediator, to work with both parties to drive that shift. I'll just take a moment to the chat function. If anyone listening, if you've got a question for Spencer, feel free to put it in, and we'll pass it on. I'm just with your because you're right, you've got a very large team there at Capital, well-oiled machine, a lot of personnel.
Yeah.
Do you assign certain roles and responsibility to sign people to register for the ASL? Is there a particular person's function, like a technician, or is it a job that's just yeah, do you have a more casual approach to no, whoever's
No, it's
there
a good question.
at the time?
I wouldn't say casual. I think yeah, we do have a large team. Like it is. I've worked in a number of pharmacies throughout my career, and this is, by far the biggest team, um, and that's very different to most pharmacies, which aren't, who may not have that, I guess, scale in terms of team size. That's just the nature of pharmacies as small business. And yeah, I guess for us, everybody, I would expect, yeah, everyone in dispensary or sort of at that end of the um, that zone of our function, if that makes sense.
Sure.
Yeah, knows what they're doing in that ASL space and understands all the aspects. Just because you run into it so frequently, right? So the
Right.
case study was very good, I think, because that's a quick example of somebody who's stuck, who's out of town, who needs a solution. And yet the ASL provides that. But that's, one of so many, I guess, scenarios where you can use ASL to provide a solution, if that makes sense.
Yes,
and
yes.
then kind of ease things for people and help them with the medication in quite quickly. Yeah, because
Yeah.
the alternate to that, the old school method, as you know, is, oh, I didn't bring my scripts. You call the pharmacy, they fax them over. You have to get them in the mail, or you have to try and hook them up with a
Ooh.
prescriber who can re-prescribe. And there is, as I say, a lot of friction there, right? So as opposed to quick consent process, and then bang, we dispense the script. There's no follow-up. Oh, enjoy your holiday. Like that's
Yeah. That's
it's
right.
quite nice. Yeah.
What about the use and adoption amongst your customers in Bathurst with apps, the mobile apps? I mean, are you seeing a large percentage using apps to help manage those who have
Yeah.
registered, or is it more specific or unique to those that are a little bit more digitally mature or literate in the community, for example?
Oh, good question. I think I guess I would say, or my observation would be that it would surprise you how many people really do, are happy to use their phone and apps for a lot of things. Um, yeah, so all you have to do is ask, like really, if you want to get into it,
Yep.
and out of and making, you actually make that asking part of your process is the important part to me, because you can't just assume that people would or wouldn't like this sort of tool or function in their health care sense. Yeah, the
Yep.
assumption definitely just squashes everything. You should definitely ask everybody as you go along. I think the whole presentation previously was actually really good because it kind of goes through all the different aspects of the ASL. The activation code specifically, it's really important to know, because I would say, if I had to guess, I'd say a lot of pharmacists are really used to maybe signing people up for MedAdvisor with an activation code, which links that app to your software, right? Only more recently have you now been able to connect an app to ASL directly. So MedAdvisor has that function now, but of
Yep.
course the Medicare app, you can also do that, and that's pretty cool that it's just a pharmacy that, I mean, cool in a sense, I guess. We're the first ones able to help make that connection and be the ones to
Yep.
provide that code and that support and coaching, right?
Yes.
So I think that's actually really a big responsibility for us to make sure that we inform people on the importance of that and how they can use it. And hey, you don't all the time. Like I can help you basically have digital scripts on file, as you put it,
Yep.
which is a nice way to put it, or I can actually give it to you in the palm of your hand and you can pull it up yourself.
Yeah, exactly. Again,
Sorry,
just
it's a bit patchy here. Apologies.
that's all right, mate. I understand. No, I think that's a lovely sentiment. And I've always come back to, the pharmacy in town is one of the strongest relationships we have, or trust. It's about trust, right? And I think the advice you guys give, a lot of Australians should feel empowered and confident in relying on your recommendation and advice here as a trusted source. And that's why you've been by default at the coalface there, especially with the rollout of this technology. And it shouldn't surprise if for those listening, if they didn't realize, when we're at the height of COVID and it was really affecting us in 2020, it was Fred IT who said, we've got the technology. We just need the federal government support, legislate. It's basically the legislation stopping us from rolling it out, but the functionality has been around. We've been wanting this for a long time. We've designed it and built it in a way to streamline and make life easy, especially if you're a very busy pharmacy, right? And that's why it's such a wonderful example of digital health use and adoption, because when the technology had been built, it was just a legislation issue that had to be solved, and then educating Australians as we go along to get familiar. And that's the challenge, I think, now, is this communication, education piece for every Australian to understand the benefits are there. Yeah. Do you do any advertising in have you done any, I know you probably did in the past during COVID, but do you have any advertising? Do you need more advertising resources from the PHN to promote ASL perhaps?
Not for us locally. I think, I mean, maybe you would have access to the data, which would be pretty cool to see. But if I had to guess, I would say that Bathurst has quite a high uptake of that technology and option. I think it's assumed just at this point that e-scripts are available at every pharmacy here in Bathurst. But yeah, I think if you're more rural, and maybe if that's not as common a script generating and management tool you use, advertising would help, but also the relationship with local doctors would definitely is definitely important as well. And it's nice to see this. It's actually very nice to see the slides of the doctor's prescribing platform too, just because it helps. It does really help a pharmacist and that relationship, knowing what they're looking at when they're trying to prescribe a script, or knowing what they have to go through, right? So you can't, if you make just assumptions on how easy or hard it is for them to click a button over, then maybe your communication won't be so great, and that's not so nice, and you won't get everyone won't come to like a mutually beneficial outcome. So it's good to know what they're dealing with, so you can properly guide and advise. Perhaps that'd be it's nice to see that. Yeah, very useful.
Now, you heard me using it as an example during that little case study with Tracy, but I'm keen to get your perspective and what you've done in terms of, for those customers into your pharmacy who don't have or choose not to give you their mobile phone number, email, there's no digital connection whatsoever. What has been your team's approach to still get them registered and still make sure legally you're complying with that consent?
So it's honestly pretty much exactly what you explained. That's the workflow we'd follow. Is that you every step of the way make sure they understand what we're agreeing to. We'd either use like the care mode in our software. I know some softwares allow for you to like allocate a I guess a care person or a responsible individual, and otherwise you could use the store email, but understanding they know what's being sent through and making notes about it probably is the most sensible work brand in my mind. The key aspect there, and that probably just communicate what the function of this cloud access entails, and I think the wording of it's having scripts on file digitally is probably the easiest, most digestible kind of terminology you might use, because everyone's a lot of people are already used to the scripts on the wall, they're in the files. It's no different. It's just the digital version, and we need to do a quick access consent piece here.
Great. In fact, that's so important, and the pharmacist from Forbes used the same expression. It was very important to use simple language to explain to most people, like saying MySL active script, it's not going to provide any real context. By saying we have a digital script on file, it's much easier to understand. I think that's lovely.
You can have to break it down a bit. I think like I guess maybe what generation you're from. It's like you might have grown up hearing the term cloud, right? Cloud-based all the time, or you might have in your working career run into now everything's cloud-based. But
Yep.
a lot of people are just like, what is the cloud, right? So
Yep.
you kind of really have to just maybe use terminology that suits the individual you're talking to. Yeah.
Yeah. And you're right. Mentioning cloud can also invoke fear. And so the
What is
context.
Yeah, exactly.
Yeah.
What are you even talking about? People are always talking about, I don't know what it is. And you're right. And then there's hesitation and no, maybe I'll do it next time, right? It's like, okay, well, I want to help you now.
Exactly.
So
that nurturing and education is critical. Thank you for
that's it.
emphasizing that. Well, look, just before we wrap up, I don't see any more questions in the chat, but Spencer, if there's one piece of advice you've got for fellow pharmacists, if someone's listening and they haven't quite adopted this as a workflow, what would be do you think some advice, practical advice for a pharmacist to really embed this?
Yeah, I'd probably say the one thing I might think about or consider is that, like, pharmacy. I mean, yeah, pharmacy it's a busy place. It's a small business, as every pharmacist would know. As a pharmacist, you have to wear many hats, right? I guess I would say that sometimes there's hesitation or like, I guess hesitation to change processes because what we're doing works well now. But I would just encourage everyone to go, like, sometimes not changing is costing you more time. Would be the biggest thing. So everyone's busy and trying to make things smoother and make your life easier. But yeah, change takes time, and I would encourage everyone to invest in that time to actually then get over the hurdle, and your life will be easier, which is quite nice.
That's right. Thank you, Spencer. Words of advice. Really appreciate it.
That's right.
And that wraps up our webinar. 3 minutes to 2, as promised, in the hour. I want to thank you all for tuning in today. And if you're listening on YouTube, it's been a pleasure. Please reach out to the PHN team if you're in need of support on the ground for practical training. We are here for you. Don't be strangers. Until next time, see you then.